Welcome back to my channel of an everyday life of an Aspie. If you're new to my channel, I welcome you with open arms. I'm Aspie. I'm all about creating mental health and awareness, sharing my life stories with Asperger's syndrome, OCD and the like, as well as other mental health conditions that may come along your way, along with tips and advice, as well as just, normal form of words of encouragement as your mental support advocate or what have you. It has been brought to my attention, as I said, that there are going to be some mental health topics that may not have been addressed either on my channel or not much on other people's channel, but I feel in my heart to share them, especially the nitty gritty stuff that will be coming up real soon, based on my life experiences, as well as hopefully just being a voice for you all, for the ones that may need to know what's going down, of knowing those signs and symptoms or what have you, so that you can keep yourself safe, sort of thing, which obviously, we need to feel safe in our mental state as well as our physical state, no matter what goes down. So this one's obviously going to be avoidant personality disorder, so give me the like for thumbs up that you're actually engaging and supporting me, just as well as liking the content, or just, feel free to comment below and let me know, as well as maybe sharing your life stories of some of the stuff that I'm about to share, hopefully, because I want to open this for discussion, and hopefully you don't feel too pressured in sharing your life story of whatever topic it may be that is correlated to what I'm sharing, because as I said right now, we need to be a voice for everyone around us, because some of this still does exist of certain everyday things that goes on in our everyday life, regardless what it may be. So this one's obviously, as I said, avoidant personality disorder. Just a disclaimer out there before I begin, as always, I'm no medical doctor, I'm just your normal everyday Joe vlogs, sharing my life stories with Asperger's syndrome and the like. But if you see any warning signs and symptoms based on any of these kind of conditions that I'm bringing out, do seek professional help for yourself or your loved one, as well as seek an opinion. Basically, even though we know sometimes we shouldn't have to do it alone, and sometimes with some other bits and pieces of these ones I'm sharing can be really hard to actually get our loved one the help, sort of thing. And if all else fails, we need to find best solution for ourselves regardless of what's going down. So let's begin this. As always, people will question on their mindset right now, what is avoidant personality disorder? Okay, well obviously I'm here to discuss this. So what it is defined as, it is a characterized obviously by feelings of extreme social inhibition, inadequacy and sensitivity to negative criticism and rejection from others. Yet the symptoms may involve more than simply just by being shy or socially awkward. Avoidant personality disorder causes significant problems that affect the ability to interact with others and maintain relationships in their day-to-day life. About 1% of the general population will have this disorder, however. This disorder is a class C personality disorder. Those affected display a pattern of social exhibition, feelings of inadequacy and inferiority, extreme sensitivity to negative evaluation, and avoidance of social interaction with others, obviously in the social environment, despite a strong desire to be close to others and wanting to socialize, even if it is really hard for them, in a way of just, socializing, Individuals with this disorder tend to describe themselves as uneasy, anxious, lonely, unwanted, and isolated from others. The behavior typically begins by early adulthood and occurs across a variety of different situations, regardless what it may be. People with avoidant personality disorder often consider themselves to be socially inept or personally unappealing and avoid social interaction for fear of being ridiculed, humiliated by others, rejected by others, or disliked by others. As the name suggests, the main coping mechanism of those with this disorder is avoidance of the feared stimuli. Avoidant personality disorder is usually first noticed in early adulthood, as I said, with both childhood emotional neglect, in particular the rejection of a child by one or both parents, and a peer group rejection being associated with an increased risk for its developmental stage. While some scientists claim the exact causes for the disorder are still unknown, others found that parents of avoidant children seems to have difficulty with their own negative emotions, however. The causes of avoidant personality disorder are not clearly defined and may be influenced by a combination of social, genetic, and psychological factors, however. The disorder may be related to temperamental factors that are inherited, specifically various anxiety disorders in childhood and adolescence have been associated with a temperament characterized by behavioral inhibition, including features of being shy, fearful, and withdrawn in new situations and surroundings that they're in. These inherited characteristics may give an individual a genetic predisposition towards avoidant personality disorder. Childhood emotional neglect and peer group rejection, however, are both associated with an increased risk for the development of this disorder. The symptoms to look out for, obviously, for this is those with this disorder may often choose jobs of isolation so that they do not have to interact with public regularly, due to the anxiety and fear of embarrassing themselves in front of others. Some with the disorder may fantasize about idolize, accepting affectionate relationships due to their desire to belong and fit in, and so on. They often will feel themselves unworthy of the relationships that they desire and crave for, so they shame themselves from ever attempting the relationship that they're trying to go through. People with avoidant personality disorder are preoccupied with their own shortcomings and form relationships with others only if they believe they will not be rejected. Loss in social rejection are also painful that these individuals will choose to be alone rather than risk trying to connect with others. I'm going to talk more about how to handle rejection in one of my videos before my nitty-gritty one, hopefully, so that we can understand this, just a step-by-step guide based on how I go about it, so bear with me. Continuing on. As we know, when they have this risk of trying to connect with others, they often view themselves with contempt while showing an increased inability to identify the traits within themselves that are generally considered as positive within their societies. So here's some, as I said, symptoms to look out for, which is hypersensitivity to rejection and criticism, self-imposed social isolation, extreme shyness or anxiety in social situations, though the person feels a strong desire for close relationships, avoids physical contact because it has been associated with an unpleasant or painful stimulus in the past, feelings of inadequacy, drastically reduced or absent self-esteem, self-loathing, autophobia or self-harm, mistrust of others or oneself, exhibits heightened of self-doubt, emotional distancing related to intimacy, highly self-conscious, self-critical about the problems relating to others, problems in occupational functioning, lonely self-perception, although others may find the relationship with them meaningful, feeling inferior to others, in some extreme cases agoraphobia, uses fantasy as a form of escapism to interrupt their painful thoughts. Avoidant personality disorder symptoms may include a variety of behaviours such as listed: avoiding work, social or school activities for fear of criticism or rejection. It may feel as if you're frequently unwelcome in social situations, even when it is not the case. This is because people with avoidant personality disorder have a low threshold for criticism and often imagine themselves to be inferior to others. They have low self-esteem, self-isolation. When in social situations, I should say, a person with avoidant personality disorder may be afraid to speak up for the fear of saying something wrong, blushing, stammering, and otherwise getting embarrassed. You may also spend a great deal of time anxiously studying those around you for signs of approval or rejection. A person who has an avoidant personality disorder is aware of being uncomfortable in social situations and surroundings and often feel socially inept. Despite this self-awareness, comments by others about your shyness or nervousness in social settings may feel like criticism or rejection when it's not always the case. This is especially true if you've been teased or if you are teased in a very good-natured way about your avoidance of social situations. Social impact of avoidant personality disorder. As we know, basically, avoidant personality disorder, as I said before, causes a fear of rejection that often makes it difficult to connect with other people around us. We may be hesitant to seek out friendships, relationships, or what have you, unless we are certain that that other person will like us for who we are. When we are involved in a relationship, however, we may be afraid to share our personal information, thoughts, or even talk about our feelings. This can make it difficult to maintain intimate relationships or close friendships. According to the American Psychiatric Association Diagnostic and Statistic Manual, or shall we say DSM-5, a person diagnosed with avoidant personality disorder needs to show at least 4 of the following criteria. Avoids occupational activities that involve significant interpersonal contact because of fears of criticism, disapproval, or rejection. Is unwilling to get involved with people unless they are certain of being liked. Shows restraint with within intimate relationships because of the fear of being shamed or ridiculed, is preoccupied with being criticized or rejected in social situations, is inhibited in new interpersonal situations because of feelings of inadequacy, views self as socially inept, personally unappealing or inferior to others, is unusually reluctant to take personal risks or to engage in new activities because they may prove embarrassing. Avoidant behaviour may commonly be seen in children or adolescents, but a diagnosis of personality disorder cannot be made in childhood because of the shyness, fear of strangers, social awkwardness, or being sensitive to criticism are often a normal part of the childhood development as well as the adolescent development. A mental health professional can assess your symptoms by making an accurate diagnosis and suggest the appropriate treatment options. Psychologist Theodore Merlin notes that because most patients present a mixed picture of symptoms, however, their personality disorder tends to be a blend of a major personality disorder type with one or more secondary personality disorders types. He identified 4 adult subtypes, however, of this disorder. The subtype, phobic, including dependent features. Features is obviously general apprehensiveness displaced with avoidable, tangible, precipitant qualms and disquietude symbolized by repugnant and specific dreadful object or circumstances. Number 2, conflicted, including negative statistic features. Internal discord. For the feature for this is internal discord and dissension, fears dependence, unsettled, unreconciled with himself, hesitating, confused, tormented, paroxysmic, embittered, unresolvable angst. Number 3 of the subtype is hypersensitive, including paranoid features. The features for this is intensely wary and suspicious, alternately panicky, terrified, edgy, and timorous, then thin, high-strung, petulant, and prickly. Last but not least of the subtype is self-deserting, including depressive features. The features on this part of it is blocks or fragments self-awareness, discards painful images and memories, casts away untangible thoughts and impulses, ultimately rejects itself, which is suicidal. The diagnosis of avoidant personality disorder, there are 2 parts of this, is obviously WHO has listed a few of the avoidant personality disorder as anxious avoidant personality disorder, basically, and WHO obviously is the World Health Organization. It's abbreviated, and it has been characterized by at least 4 of the following from them: persistent and pervasive feelings of tension and apprehension, belief that one is socially inept, personally unappealing or inferior to others, excessive preoccupation with being criticized or rejected in social situations, unwillingness to become involved with people unless certain of being liked, restrictions in lifestyle because of need to have physical security, avoidance of social or occupational activities that involve significant interpersonal contact because of fear of criticism, disapproval, or rejection. Associated features may include hypersensitive to rejection and criticism. It is required of ICD-10 that all personality disorders diagnosed also satisfy a set of general personality disorder criteria. APA, which obviously stands for Avoidance Personality Analysis, which obviously, as I mentioned before, the DSM-5 also has an avoidant personality diagnosis. It refers to a widespread pattern of inhibition around people feeling inadequate and being very sensitive to negative evaluation. Symptoms can begin, as I said, as early as adulthood and may occur in different range of situations, but obviously they suggest in the DSM-5 4 of the 7 specific symptoms should be present, basically, and they are the following: avoids occupational activities that involve significant interpersonal contact because of fears of criticism, disapproval, or rejection. 2 is unwilling to get involved with people unless certain of being liked. 3 is shows restraint within intimate relationships because of the fear of being shamed or ridiculed. 4 is preoccupied with being criticized or rejected in social situations. 5 is inhibited in new interpersonal situations because of feelings of inadequacy. 6 views as socially and personally unappealing or inferior to others. And 7 is unusually reluctant to take personal risks or to engage in any new activities because they may prove that they're embarrassing. The treatments for APD is, as with other personality disorders, a mental health professional will design a treatment plan that will be best appropriate for you. Every treatment will vary from person to person, just to bear in mind, but they will talk likely to include talk therapy if a coexisting condition has developed, such as depression or anxiety disorder. It is also diagnosed appropriately with appropriate medications that maybe also have to be used. Just to be in mind though, there are other conditions, basically. Other mental health disorders can occur along with APD. Treatments in these cases will be designed to help with the symptoms of each disorder. A few of the conditions that most frequently occur with this disorder of APD will include social phobia, in which a person experiences overwhelming anxiety and self-consciousness in common social situations. Dependent personality disorder, in which people rely excessively on others for advice or to make decisions for them. Borderline personality disorder, in which people have difficulties in many areas including social relationships, behaviour, mood or self-image. Many avoidant personality disorder symptoms, however, basically many avoidant personality symptoms are commonly shared among these other conditions, particularly in the case of generalized social phobia. Because of this, the disorders can be really confused. It may take some time for a mental health professional to make a clear diagnosis, however, and choose the appropriate treatments for you, so be patient with them. They may need to do their research and whatever else. So this quickly ends avoidant personality disorder. Give me a like, full thumbs up for support, comment below. Basically, feel free to follow me on my social media sites listed below. Feel free to subscribe to my channel if you haven't done so. Don't forget to turn on the notification bell so you know when the next upload is ready to up and loading, so you know what Aspie's up to. Feel free to share these videos around to family and friends. As I said, I want to create as many as I can, as awareness and understanding for each of us. So in all further ado, guys, thanks for the support, thanks for watching. Do what you love.